So good morning, everyone. My name is Aglaury Núñez-Morales. I am the Director of Training for Behavioral Health at Salud Family Health. And today we will be talking about acceptance and commitment therapy for Spanish speakers. This is a topic, it's a little bit complicated. I thought when I was doing the presentation, because it's pretty much the same as we would do with English speaking patients. And literature review says that it is a good treatment for diverse populations, right? It has shown to be good to be used with many diverse populations and many different, I would say, diagnosis or experiences of symptoms and difficulties. So I'm gonna go through the objectives first. I'm gonna just go through some of the core concepts of the ACT model, and we're gonna talk about them in both English and Spanish. I wrote most of it in English, but also some of the concepts I added in Spanish as well, so we can know how we would say it and use the terminology in Spanish as well. I'm going to provide some resources that I found for ACT in Spanish, specifically some metaphors and some websites, books that I have noticed that are also in English, but also in Spanish. And I feel when we're providing services in Spanish, sometimes it is worth it to be able to read or know the terminology in Spanish as well. And then I will promote or open space for some discussion around your experiences using ACT in Spanish and with Spanish-speaking patients, and see if there's anything you have noticed that you would like to share with us. Good. So first of all, what is acceptance and commitment therapy? Let me see if I can, there we go. Lower this a little bit so I can see some of you and also see my slides. So it's behavioral therapy. It's based on, or it promotes value guided action, which means that you want people to know what they want to stand for in life, to identify what it's really important for them, what matters for them, and take mindful action, which means to take conscious action and have full awareness of what they're experiencing, inwards and outwards, right? In the inside and in the outside world as well. So from Russ Harris, right, we have that ACT is to accept what is out of our personal control and commit to action that enriches our life, right? So one of the main things about ACT is being able to know what it's the mind, ¿verdad? ¿Qué es la mente? And identify and being able to observe that in different ways. So what is the mind, right? What is that all about? So the mind is, the theory talks about it being language, which means it's words, right? What are thoughts or words? We have images, sounds, sensations, and most of our thoughts, and this is something we talk about a lot when we're talking about ACT with our patients, most of our thoughts are by nature negative. So 80% of those thoughts that our mind produces daily are negative. So that's also something that's important to recognize, to be compassionate with ourselves and our thoughts and our mind, and being able to reduce maybe a little bit of that guilt that we might feel from what our mind is telling us. So again, the goal of ACT is to create a rich, full, meaningful life while accepting the pain that inevitably comes with it, or life brings. One of the goals, and I guess people talk a lot about psychological flexibility or flexibilidad psicológica, and it is the main goal of this model of therapy is to gain psychological skills to be able to handle painful thoughts and feelings in an effective way, so they have less impact and influence on our um, life and our decisions and actions. Also, it's important to clarify what it's important and meaningful for you, so you can know where you're heading, right? Identify those values so you know where you're going in life and what you want your actions to uh, be. And use those values to guide and inspire, motivate you to set goals, to take actions that make you feel like you're living a life that it's worth living. So cognitive or psychological flexibility, I'm sorry, it's mindfulness plus values plus action. And ACT has its own acronym, which stands for A, accepting your thoughts, feelings, and being present. C, choose a valued direction. And T, take action. So here we have all of those components of ACT, would have them both in English and Spanish. So when we're talking with our Spanish-speaking patients, we're talking about flexibilidad psicológica, we're talking about atención al momento presente, valores, compromiso, ¿verdad? O acción con compromiso, yo como contexto, defusión y aceptación. So those are the core components that we will be discussing today. Oops, I'm sorry. So one of the things that Russ Harris talks about, it's fear, and uses some acronyms to kind of describe what ACT looks like, and what happens when we are fused or we're not living the life as we want to live it, and then how we can work with creating the opposite, right? Or work with ACT. So he talks about fear, which is fusion, having excessive goals, avoiding discomfort, and remoteness from values, being distant or losing touch with what's really important for us. And he also uses there, which is diffusion, acceptance of that discomfort, setting realistic goals, and embracing values. First concept that I'm going to talk about is diffusion or difusión cognitiva. And difusión cognitiva talks about watching what you're thinking or observar nuestros pensamientos, detach from our thoughts, separarnos de esos pensamientos, and stepping back and watching what we're thinking. Not going along with those thoughts. So en un state or in a state of fusion, we can think that our thoughts are absolute truth, right? That they're commands that we have to follow, that they're threats that are gonna hurt us in any way. we can see our thoughts as something that are actually happening right now, and that feels like it's happening right now, what actually happened in the past or in the future. Um, and also as something really important that requires our attention. Um, when we are diffused from those thoughts, um, we recognize that our thoughts might be true, might not be true. Um, we know that they're not any commands, right? That they're there, but we don't have to obey them. There's not a rule that we have to follow. It's not a threat, right? When we sit down and we're observing our thoughts, we recognize that we can be thinking about something unpleasant or something really um, horrible and not necessarily it's gonna hurt us in the way that we're seeing it or it's happening in our mind. Um, it's not something again that's happening in this physical world. They might be important, might not be important, and we can allow them to be there and come and go without our need to push it away or control them in any way. How do we work with fusion then, right? When we're with patients, how can we work to promote diffusion? I'm sorry. So here's some of the metaphors that I could find in both English and Spanish, um, and some things that you can practice in session with your patients or clients. And first one is las manos como los pensamientos, right? Not gonna go into detail of each one of them because of the time, but um, basically what it talks about is using your hands as if they were your thoughts, and then making an exercise with them, right? What happens if you uh, push them away really hard, right? And imagine that you're in a wall or something, right? You're gonna get tired. What happens when your hands come to your face real close, right? You can't see clearly. And what happens if you lay them down? Well, they're still there, but I can see things and experience things in a better uh, or in more clear way, right? And describe those things. Um, One thing that I really like using is asking um, patients or clients to talk about and say this phrase when they're thinking whenever they can. And the phrase is, I am having the thought that, estoy pensando o estoy teniendo el pensamiento de que I'm not good enough. I am having the thought that I'm too tired. I'm having the thought that I'm always lazy, right? I'm always this, or I'm always that, or whatever thought you're having, right? That um, so that constant repeating of estoy teniendo el pensamiento de que kind of creates by itself a differentiation between um, being in a state of thinking by being in a state of observing and recognizing what thoughts I'm having. Musical thoughts, and it's one that makes it a little bit, and there's another one so-called silly thoughts, like pensamiento tontos, or it's kind of making fun of your thoughts, but I wouldn't recommend using it unless you have a really, really good relationship with your patient and they quite understand the concept, because you're not trying to mock them or anything like that. You just want them to kind of make fun of themselves or their thoughts, but they need to be able, right, and open to do that without feeling bad about that. Um, so musical thoughts, imagine that you're having your thoughts, right, and you can see them in words as if there were karaoke lyrics, right, and then you can go through them and put them color and maybe go the ball hopping through the words and kind of, or you can even sing them like as if there were like happy birthday song, and kind of sing your thoughts in that kind of way. So it's again multiple things that you can use, or strategies that you can use to help that person identify that what they're having are thoughts, are words, are images, are sounds, letters, right, and not necessarily um, everything else that we talked about when we are fused. Naming your stories is another one. Let's nombrar tus historias, right? I think we typically have our own stories or our own struggles, right? When it comes to different themes that our mind repeats to us in certain times and spaces. So naming those stories can be helpful to also recognize and differentiate or diffuse from those thoughts. Aceptación or acceptance, also called expansion. It's actually the opposite of avoidance, right? When we avoid having a thought, we don't want it, we want to push it away, we want to make it disappear, we don't want a thought at all. So it's the opposite of that. It's allowing those painful feelings, sensations, and emotion to be there as they are, right? You don't have to like them. You don't have to want them there. You just have to let them be, right? And recognize that you're having them and let them be. And I like this a lot because when we're talking about acceptance and mindfulness, we think it's all about meditating, right? And there's a phrase in one of the books, I don't remember which one, from Russ Harris, that he says it's not meditation, right? It's not. That's not what it is about, right? So when we're working with acceptance and we're working with aceptación y mindfulness o vivir en el momento presente, we got to think that it's not all about mindfulness, right? I mean, meditación. I'm sorry. It's being mindful, it's being present, but it's not always meditating. And we're going to go through that a little bit en el futuro. So working on acceptance. There's a metaphor, se llama la metáfora de las arenas movedizas, la metáfora del hoyo y la pala, ¿verdad? O el hombre en el hoyo, también le llaman así. So there's few metaphors that you can use with your patients to kind of describe acceptance and how being desperate or desesperarnos demasiado. For example, el hoyo y la pala, right? Estás en un hoyo, tienes una pala, but you can't go out, no puedes salir, entonces comienzas a acabar y acabar, tratando de resolver el problema. Y cuando miras, lo que has hecho es que el hoyo sea más grande. Y ahora es más difícil salir del hoyo. ¿Verdad? ¿Qué otras opciones podrías haber hecho, verdad? Podrías esperar a que alguien pasara, quizás te viera, ahora quizás no te ven porque el hoyo es muy profundo, ¿no? And different things that you can discuss while using that metaphor with your patients. But to practice acceptance, you can also lead your clients to practice 4 steps. First of all, observar, breathe, respirar, create space for whatever you're feeling and you're thinking, and allowing yourself to just be there with those feelings, sensations, and thoughts. And practice acceptance, self-talk as well. So again, vivir en el momento presente. When we talk about living in the present moment or mindfulness, again, not meditation. And I like that image of the dog and someone going on a walk, because it's just being there, conscious of your environment outside and inside as well. So it's creating that connection and connecting and engaging with what's really going on at that moment. Again, in the world around us and within us as well. It's okay to practice mindfulness for relaxation, right? Mindfulness, like let's take a deep breathing and those exercises, because it does have some meditating within it, right? But it's not itself what we're teaching necessarily. So working on mindfulness, again, you can practice a lot of connecting with environment, connecting with our body, and kind of reflecting on that and just being there and being able to connect with what you're feeling, You're tense, not tense, what hurts, what doesn't hurt, what feels good, what doesn't. Awareness to your breathing, being aware of what you're listening to, what you're able to hear around you, connecting with a pleasant experience, and also at some point guiding patients to connect with those things that are not so pleasant, right? Or connecting with something that they have been avoiding for some time. So next concept would be el desapego del yo conceptualizado o el yo conceptualizado, the conceptualized self, o el yo observador, the observing self. En este caso, we're working on awareness, again, awareness of our thoughts, awareness of what's going on within our mind. The conceptualized self, it's not non-judgmental because judgments by themselves, like judgments are basically thoughts, right? So again, it's non-judgmental. You don't judge what you're feeling, it's just being aware of it. And it talks about self as a description, right? Or self as concept, which also means that it's kind of a way of describing ourselves or being aware of the things that we use or we think describe ourselves as well. And sometimes if we're fused with that description of who we are or who we should be, we often have trouble as well. So that's a concept that I really like, diffusing from that self-description or that's those beliefs of what we think we should be or we're not. So how to work with this in therapy or with our patients? There's a metaphor, la metáfora del tablero del ajedrez, which basically, when you're playing chess, you're an observer, right? You're just an observer. You're seeing everything from up top and you're just moving things, right? And making decisions. But you're seeing everything from a perspective, from an outside perspective. So that's a good metaphor to use to explain the observing self or the conceptualized self. You can work with people or patients on noticing their thoughts, their feelings, their beliefs, their actions, right, and their behaviors. I like this part of identifying your story, which means what are some facts about yourself, right? What's your name? That's a fact, right? What's your age? Maybe the sex could be a fact. Cultural background is a fact, right? It's not. We can change that. Our occupation might be a fact about us as well. Identifying descriptions. What roles do I feel describe me? What relationships do I feel describe me? What are my dreams? What are my aspirations? And evaluations that I might make about myself, such as what are my strengths? What are my weaknesses? What do I like? What do I dislike? And being able to see that gives us a sense of understanding of ourselves and our stories. Values or los valores, like we talked about at the beginning, es hablar de what really matters, right? ¿Qué es lo que realmente es importante? And what do you want your life to be about? Do you want people to remember you, or what do you want people to remember you for? I should say, it's not like in your funeral, what would you like people to say of what you were and you represented? And it's important to differentiate values versus goals, right? Goals are things that we're meant to necessarily achieve, and we get there and we know we completed it and that's it and we did it and we move on, right? Or we keep doing it. But values are concepts or our motivations that keep us going and going and going, and they're ongoing all the time. They're present all the time, and not necessarily we don't achieve them and say, oh, I achieved that, right? It's not possible. They're continuous. So identifying with your patients, what do they really want on the inside? It's what you're going to work with when it comes to values. So there's some activities that you can use to identify values. There's a questionnaire that's called the Life Values Questionnaire, and it divides some questions in different areas of patients' life or story, which relationships, work and education, personal growth, health, and leisure. For example, some of the examples that you can see for relationships, and I put them in Spanish since this is for Spanish speakers. Algunas de las preguntas que puedes hacer para relaciones o el área de las relaciones es qué tipo de relación deseas, ¿verdad?, tener con tu familia, qué tipo de relación quisieras tener con tu mamá, padre, ¿verdad? ¿Qué tipo de madre, padre, hijo, hija, hermano tú quisieras ser? ¿Qué tipo de relación te gustaría construir con tu madre, por ejemplo? ¿Qué implica tener una buena relación con esa persona? ¿Y qué acciones deberías hacer para tener una buena relación con esa persona? Y de acuerdo a ese valor, ¿verdad?, de tener una buena relación, o lo que significa tener una buena relación, pues, ¿qué significa para ti vivir de acuerdo a ese valor? ¿Cómo se ve eso? How does that look like? Oops, again. Committed action o acción guiada por nuestros valores. Basically, it's do what it takes to live by your values, and doing what it matters, even if it's difficult or uncomfortable. It's really interesting because sometimes we think, well, we are talking about diffusion, we're talking about all these things, and something about diffusion is that and acceptance and commitment therapy in general, it's recognizing that our thoughts are not gonna go away, right? They're gonna be there. So if it's hard for me to do something, and I always get these thoughts about self-doubt, or I'm self-conscious, or I'm too tired, or whatever, right? You're always gonna have those. So basically, you have to make a commitment to take action, even when you might have those uncomfortable feelings, when you might have those uncomfortable or difficult thoughts. So when you're working with committed action, since it's all about action and getting to do things that are congruent or that are aligned with your values, you can set meaningful goals with your patients. So summarizing those values could be the first step. Then setting an immediate goal, something that they can do immediately, something that they can do short term, medium range, and then long term. So all of these things could be things that you can work. If you notice that that's something that are also techniques that we also use, or approaches that we also use in other type of therapies, like exposure, behavioral activation, skills training, and visualization. All of those things you can use when it comes to committed action. During your therapy session, you can work on visualization of those actions, like how does that look when you're doing it, and kind of go through it in a session, or even exposure if you have the opportunity to do that with your patients. So this one a little bit fast. Let me see. Okay, good. So kind of a summary of everything is act, So we are talking about gaining that psychological flexibility. And in order to do that, right, you have to be present, you have to open up and allow yourself to experience what you're experiencing. Okay, sorry, I was reading the chat. And then do what matters, right? And we got diffusion and contact with the present moment, right? We have self as contact, committed action, acceptance, and values. And the good thing about ACT is that it's not fixed, right? It's not set up to be, you have to do this first, second, third, fourth, right? You can do that in different ways as they come up in therapy. And one concept, as we were talking about committed action, we were also talking about diffusion. We were also talking about value. So it all comes together, and everything plays a role when it comes to talking about a concept, for example. They're not like isolated things, they're all together, and they all play an important part of the therapy model. Let's see. So these are some books that I found in Spanish. And yeah, these are some books that I found in Spanish. I know some of these you might know. With this, I make simple, but it's now Hazlo Simple. In Spanish, it was translated by Manuel Manzano Gomez. And then The Happiness Trap, I think it's a really good one. It's a self-help book that Ross Harris had, que también se tradujo al español como La Trampa de la Felicidad. And it's really good because since it's meant to be for everyone, and kind of a self-help book, you can also take ideas from it, and ideas on how it would look like for your patient, for example, to practice diffusion, to practice identifying values, and you can find resources there as well. And they also have some links online that you can use that are free. So this one is from Ross Harris, and he talks about basically all of this, but also ACT Made Simple. We have The Happiness Trap. They have like some worksheets that you can use. I couldn't find them necessarily in English, but I guess if you buy the book, it does have some strategies that you can use specifically in Spanish, since it's translated to Spanish. And here I found some metaphors. They're the same metaphors that we sometimes use in English, but they were already translated, and kind of give you an idea of how that would look like in Spanish, right? How words that you can use. There's a really good book of metáforas, but it's in inglés, así que, but if you go online, like I said, you can look at la metáfora o la idea detrás de esa metáfora, and you can incorporate that in your therapy as well. So I want to know if you have any comments, any questions, if you want to share your experience using ACT with Spanish speakers. What do you think? Like I said, I was looking at research, and it does work with diverse populations, with diverse problems or diagnosis, so I think it's really a really good therapy model to use, and not only use with patients, but guide your life by, if that makes sense. Live it yourself as well, so you can show others, right, how to live their life meaningfully, guided by their values and what really matters for them. So any comments, any questions? I saw something on the chat saying that if we were going to share it, I guess so. Yeah, it seems like you can see it, and I will share that as well with them so they have it. also have some references here, which are basically some of those books that I put there. I'm going to stop sharing so I can see you guys and see if you have any questions.
I have a question.
Sorry, give me just a second. I can't hear you. I don't know again if it was my mistake here. Oh yeah. Okay, now I think I should be able to hear you.
Oh, okay. I think I got the answer. Someone responded to my. Can you hear me now?
Yes, yes. Oh yeah,
Oh,
they
so
responded they will not be sending it via email, but it would be posted on YouTube channel shortly.
oh, okay. Okay. Thank you.
Okay. Good.
No question, but I found it very helpful to hear some of the terminology in Spanish directly, and I'm excited to bring that back to my team. So thank you for that. We also, I don't know if you saw I'm trying to remember the book that I'm reading right now. There's a choice point exercise as part of ACT. And one of our clinicians was just sharing that she had used it with someone who was completely illiterate. So it was nice to see how she could apply some of the concepts and the visualizations, even with someone who can't read. And she color-coded things about, toward and away behaviors and actions, and was able to use it nicely with someone who was not able to read or write in English or Spanish. So I liked that we could adapt it in that way.
Yep.
I will. Can you hear me? Hello, everybody. I will add that insight is a very interesting concept that is not necessarily, it's easier to work with it with diverse population using ACT because of the use of metaphors and other therapeutic modalities. I think it would be a little bit harder to just think about the thoughts that you are thinking and what do you think about your thoughts and how do you feel about the thoughts that you're thinking? You know what I mean? Like that type of cognitive process is not necessarily part of different cultures that are not on this side of the world. So I really like to use ACT because naturally in many cultures, in narraciones, it will be easier to explain some values or to reinforce some values that helps in that healing process, if that makes sense.
Sí.
I like metáforas.
Sí, mucha de nuestra cultura latina, we have a lot of dichos también, ¿verdad? Que como que ponemos valor y aprendemos a través de metáforas, ¿verdad? Ese tipo de cosas. So I agree. It's really helpful.
I have another question. What does CFHA stand for?
Collaborative Family Healthcare Association.
Say it again, please, slowly.
CFHA, you mean? Collaborative Family Healthcare Association. I'm going to post the link for CFHA right here, so you can check out or what page you think. This group, it's called Serving Latinx Populations, and it's part of the interest group, Primary Care Behavioral Health. So it's welcome for everybody who is working with Latinx communities, especially in medical settings, but of course we welcome any wisdom, and we're always happy to share or experiences to help to continue spreading the word around best practices, modalities that will help us to take care of our Latinx, Latina populations.
All right, thank you.
Thank you for
Gracias.
Yes, I am the task force leader for the Serving Latinx populations. My apologies that I was a little bit late for the meeting, taking care of other stuff in my current job and last minute calls. So, and I appreciate Dr. Aglaury Núñez-Morales for her presentation. And next month, we're going to be talking about alcohol use in Spanish-speaking patients. Dr. Kimberly Santos will be providing that presentation. So make sure that you subscribe for the next webinar. And in March, we're going to have just a community conversation around inclusive language in Spanish, which it's a little bit trickier considering how the Spanish language is, it's how that language is when we express different things. So we're going to talk about that. It's not going to be a webinar, it's just going to be a regular conversation between members. So I hope that you can join us for February, alcohol and Spanish-speaking patients in Latinx, and March will be the community conversation around inclusive language. So we meet the last Wednesday of every month at noon Mountain Time. So make sure that, and if you need to, we have base camp as well, and I try to post stuff and their resources there. So feel free to let me know, email me if you need to. I'm gonna type my email here. If you need any support joining those things and receiving messages around what we're gonna do for the upcoming months. We have a couple of more minutes. Any questions about the presentation? Any questions about Serving Latinx? This is the time to talk a little bit more about it. Yes, there are other emails. Hannah is posting her email. Right. Well, I'm very grateful for this group, but for this space that CFHA is giving us. Thank you, everybody who attended, and especially Aglaury. Thank you so much for preparing this presentation and giving this information. It helps to have more ideas. So we are very appreciative. Gracias.
Thank you.
Thank you. Good to see you.
Good to see everybody. Thank you, Sarah. Other familiar faces. Take care. We'll see you soon.
Bye.